So today I would like to present my just first work of this one, feasibility study of hydrogen inhalation gas therapy for head neck cancer. And my team is working with in my institute, and I was the team leader of this work. First, I would like to the background of this study, and I am motivated of this work. And the objective of this work is to provide the quality life of a cancer patient during and after the treatment. So, how the hydrogen inhalation therapy works for this one, and actually, I am motivated this work. The pilot feasibility study of hydrogen gas inhalation therapy locally advanced head neck cancer. This work is done by in Thailand group. Last year when I was in Japan, I interested about this work in a innovative workshop. And the application of hydrogen here, we can see a lot of hydrogen scientific works is published during this work. And now some group is thinking hydrogen is promising for medical applications. So I'm motivated and we started this work. Actually, in my institute, we have the two facilities, PET-CT and radiation therapy. So, following the radiation therapy, the patient came in my institute, and the demographic study a lot of head neck cancer patient, and we choose this head neck patient. The cancer killing mechanism of radiation, we know that the reactive oxygen species is generated due to the radiation and as well as the chemotherapy. And this is the very fundamental mechanism of radiation therapy. The ROS like hydroxyl OH group and hydrogen peroxide, and it hits the DNA indirect and direct way. So here our theme is that if we neutralize some harmful ROS using the hydrogen, then it can ensure the quality of life. So this hydrogen cannot neutralize all types of ROS. This work only for the some selective selective group and neutralize that one. Here we can just this is the chemotherapy, how this work, and also the radiation therapy. So radiation breaks water into hydroxyl OH and superoxide and causing the oxidative damage both is. When hydrogen inhaled by the patient, it's introduced in the patient and with the alveoli, it enter in the blood stream, and due to that one, it's interact with the OH, and this is the image, and the DNA and protection also that an antioxidant effect is selectively neutralized the radiation induced, and cytoprotection protects the surroundings healthy tissue without reducing the anti-tumor effect, anti-inflammatory action, and also the mitochondrial support. Overall, it ensures the quality of life of the patient. So again, the technical problem, I think so. So the workflow of hydrogen therapy is that we choose, okay, first of this one, this study at Institute of Nuclear Medical Physics, and 10 head neck patient we selected, and the patient was irradiated volumetric modulated arc therapy. That was the dose prescribed by the oncologist, 70 gray 35 fractions, and patient also chemotherapy for 6 cycles, and 5 patient was only hydrogen therapy and VMAT, only VMAT, and on others 5 patient the intervention group hydrogen, and also the hydrogen was provided by the SuiLife device that's developed by the Japanese group. The company name is SuiLife, and we deliver the hydrogen 30 minutes for every day after the patient when the irradiate. So the baseline of patient choosing, we consider the age group, gender, and median weight, as well as the, so two group were divided this. And this is the very simple device, and the hydrogen is produced just a electrolysis process, and this is the medical grade hydrogen that control 4% hydrogen with the air, and the patient is inhalated. We can easily see this schematic diagram how the hydrogen is produced and patient can inhale like a just a simple cannula, and this device we purchased in this hospital. And the results, actually following the Eastern European radiation oncology group and also the radiation therapy oncological group, some parameters, that's mean the rating of this one. So like the overall performance of this patient, all the rate are marked as only the patient who received VMAT, and all the blue are patient received hydrogen with VMAT. So we can see the result is very promising for the performance result, and as well the quality of sleep also improved for this hydrogen. And for the fatigue patient, we know that the for radiation therapy patient is due to fatigue, and we found our result is also here is a promising result. We found that those patients received hydrogen with radiation therapy, their fatigue is reduced, and also in the appetite, their appetite also in the good during the radiation therapy. And the toxicity, we found that actually we know that the head neck patient cancer, the toxicity is much more higher than the other types of patient, and so here we can also find the results of the toxicity. We found the good result, and also the pain status. The patient is, we showed that after 3 weeks and after 7 weeks, the pain status is just reduced. So this is the sample of this toxicity status. The left column, and we can see the intervention group, both hydrogen and radiation therapy received after 3 weeks. We can see the toxicity status of this head neck skin after 7 weeks here. So due to the neutralize of some harmful ROS, that means OH, the water produced with the interaction of hydrogen, and actually the toxicity, the skin is burned, that means the dermatitis, but is not like owned. But only the in control group we can see the patient is their skin is very toxic, and we found one patient is so among 10 patients we just here is only 4 patient. So the conclusion is that hydrogen is an innovative therapy. We found promising supporting result, and it's safe and it's improved the quality of life. And this is the pilot study. In future, we have the rigorous clinical trial. Especially, we focus for 1 hour lung cancer patient and others, and brain cancer patients. So thank you all.